Great, thank you. Well, we have more questions, but before we get to them, we do have one final speaker today, Dr. Derek Robinson, who's Vice President for Enterprise Quality and Accreditation at the Healthcare Service Corporation. Dr. Robinson, are you with us?
I am with you. Good afternoon.
Thank you. Well, thanks so much for joining us today to share a little bit more about how partnerships can increase enrollment as well as your efforts to improve health literacy. So I'll turn it over to you.
Great. Well, thank you very much, and excited to have an opportunity to be here and participate in the panel today and share with you our story of outreach and enrollment efforts aimed at minority populations in Illinois. Again, I'm Vice President for Quality and Accreditation at Healthcare Service Corporation, which is the parent owner of Blue Cross Blue Shield of Illinois, Texas, New Mexico, Oklahoma, and Montana. I'm pleased to participate in this distinguished panel today with Dr. James as well as Mr. Plaza. We called our campaign in Illinois the Be Covered Illinois, and it's been a real source of pride for our plan here at Blue Cross Blue Shield. And first, I should probably give you some background on how we even got to this point. So in May of 2013, the state of Illinois announced that it had received a federal grant totaling $115 million, of which $35 million of it was earmarked to finance a public awareness and education campaign about the Affordable Care Act and the Illinois health insurance marketplace, Obamacare enrollment in other words. That marketplace would launch in October, 6 months away. And the Obama administration said that states could use these grants for marketing activities that included production and distribution of brochures, direct mail, print ads, social media, and digital online ads, as well as TV and radio buys related to promoting a local state exchange. And by any measure, $35 million represents a significant marketing and advertising effort. Now, we were the first to step forward and commit to offering insurance plans on our state's exchange, and only a few other carriers stepped forward. And keep in mind that back then insurers did see real risk to insuring a population of uninsured that no one really knew. And so most commercial insurers sat on the sidelines to see what would happen. And as the state's largest insurer, however, we were all in, but we also recognized that there were some risks that existed there as well. If there were one major concern that we had, it was what if we threw this big party along with the state and nobody showed up? And like a political campaign, we had to get people out there and signing up. And in terms of our interests, we needed a critical mass of numbers to help spread the insurance risk. And at the same time, we recognized that we also were the home state for President Obama. So we had to be sure that the state did not miss out on its mark. Meanwhile, polling found that huge numbers of the public either didn't know much about the Affordable Care Act and what was in it for them, or they still thought that it was struck down by the courts. And here we had a matter of months to turn that around. We had a real sense of urgency. So in March, 2 months before the state announced its marketing grant, we'd been contacted by Congressman Danny Davis and invited to participate at one of his community health forums in April with the goal of explaining the Affordable Care Act to more of his constituents on Chicago's west side. We committed to using that as our launch for Be Covered Illinois, and we offered an exclusive to the Chicago Tribune, which featured it on page 1 of that week's Sunday Business section. Now, while other states were quick to brand their exchanges like Kentucky's KY Connect, we knew that we couldn't be idle and wait for the great state of Illinois. So in fact, it wasn't until July 12th that Illinois awarded the contract to Hilliard Advertising, and by then the Be Covered Illinois was in full swing. So what was Be Covered Illinois? Simply put, it was an unbranded outreach and education campaign designed to mobilize and enable community groups and social service organizations. It's important to note that it was unbranded. Nowhere will you find any reference to Blue Cross and Blue Shield of Illinois, not a logo, not a mention of products, and that was a really deliberate effort on our part. It was our goal to truly provide education and not marketing, and we needed the help of the community partners to deliver this messaging to their constituents. Now, many were also serving under federal grants as navigators or in-person counselors, and they would have had to be sure to steer clear of any materials that were not seen as entirely objective. So we began with just 3 such organizations: the Illinois Maternal and Child Health and Disability Advocates, and the Illinois Coalition of Immigrants and Refugee Rights. By the time 2013 closed, we had counted over 75 organizations representing a broad swath of organizations. We had Kappa Alpha Psi fraternity, Delta Sigma Theta sorority. It was truly a broad-based effort involving social organizations, religious organizations, and the like. So all of the materials, brochures, websites, flyers, videos were all bilingual in English and Spanish. Later, the campaign added translated materials in Arabic and Tagalog. In all, more than 280,000 printed materials were distributed, primarily at 220 plus events that Be Covered hosted around the state. And you find Be Covered in the Mexican Independence Parade, at the downstate county corn festivals, and even on the radio, as we had some of our other physicians and subject matter experts interviewed on WVON, which is the longest-standing African-American radio station broadcasting from Chicago's South Side. Now, the 75 organizations and some of the logos that you see on the screen here were really folks that were hungry to equip their teams with accurate information. And Be Covered Illinois really filled a void that had yet to be taken up by the state. So through September of 2013, we were about the only game in town, the only ones distributing information to people about what's in it for them in the Affordable Care Act and why they needed to sign up for coverage. And because we were most involved early on with education and outreach through Be Covered Illinois, it garnered a lot of media attention. And at one event held in October at the beginning of open enrollment was a Be Covered Care Fair. And it garnered media coverage from 14 separate outlets, including Spanish language media, TV, radio, print, and more, and it was certainly newsworthy. We had over 5,000 individuals in attendance, literally individuals lined up outside the door and around a corner. We offered, in addition to the educational information, free vaccinations for flu, tetanus, diphtheria, as well as health screenings. And the first 2,000 attendees received a bag of healthy, fresh groceries. We also played host to 15 social service organizations that were staffed in the enrollment area, with 52 registered state navigators there to help. At that time, this was the largest gathering of certified navigators at any one event in the United States. Another target for our group were Chicago's faith community and the many large, predominantly African-American congregations, as well as large Latino Catholic parishes. We had our community outreach teams out speaking at inner-city congregations, at their Sunday services, and health fairs. And we also hosted breakfasts at our offices for prominent ministers across Chicago's west and south sides to encourage them to pass along information to their membership. Our team left flyers, posters, brochures, and postcards at government offices, public transportation sites, over 250 prominent businesses at laundromats, banks, currency exchanges, and pharmacy chains like Walgreens and CVS. So it was hard to find a place where we were not at. Within a matter of months, the effort saw 81,000 website visits and downloads. Our social media presence was strong, with over 17,000 increases in our Facebook likes. We directly reached over 900,000 Illinoisans across the state. And what does all this mean in terms of outcomes? The federal projected goal in year one was an enrollment target of 143,000 people in Illinois. When it was done, the state has signed up over 217,000, surpassing the original goal by more than 50%. And about 80% of new enrollees received a federal subsidy to pay for their coverage based on their income. Then we had another 287,000 people in Illinois who signed up for the newly expanded Medicaid program. So we like to think that our Be Covered Illinois campaign did its share. I mentioned that many states branded their exchange efforts well ahead of the October enrollment. In September, the month before Illinois' ad agency unveiled their new branding, It would be called Get Covered Illinois, and use coincidentally orange, white, and blue as its color scheme, the same as Be Covered Illinois. So imitation is the highest form of flattery, as they say. We were pleased to ultimately work in partnership with the state. Obviously, our 2015, 2016 focus, we're really looking at the newly insured, ensuring that folks understand how to use insurance, the impact of personal behavior on their health, as well as the use of healthcare resources, how to find physicians and other healthcare providers that are in network, some of the nuances of prescription drug use and access, and also where folks can seek resources and access to care both in a primary care setting as well as when it's appropriate to seek emergency care. So again, we are excited to be a leader in supporting improved access to insurance coverage in the retail market. And again, we have a very strong national presence in terms of our commitment to ensuring that individuals who are uninsured have access to coverage through the retail market. So thank you so much for an opportunity to participate in today's presentation.